Good afternoon, everybody. Thank you, Dr. Emmanuel, for the kind invitation. And as Dr. Emmanuel said, I'm going to be talking about influenza update and vaccination. So I hope I convince you all by the end of the talk to take the vaccine. The objectives of my talk are going to be to understand the influenza disease burden, the types of influenza, transmission, the common signs and symptoms of the disease itself, and some of the complications associated with it, recognize the importance of influenza vaccine in preventing the flu infection, and influenza vaccine composition, recommendations, why healthcare workers should get vaccinated, and some of the misconceptions that are associated with the vaccine. So influenza vaccine disease itself, as you can see globally, 3 to 5 million cases of severe illness are reported each year, and 290 to 650,000 deaths are reported globally. And then you can see the distribution in the European region, and also at the bottom, the annual burden of flu in the US from 2010 to 2020 as per the CDC. Again, 9 million to 41 million illnesses reported, 140 to 710,000 hospitalizations, and 12,000 to 52,000 deaths are reported due to influenza. So this is the positive flu assays in our SEHA-wide hospitals locally. You can see beginning from 2021, 22, and 23. This is distributed by the week. And you can see at the end of the slide that the flu season is still coming up. So our numbers of influenza are increasing. And in the last year, you can see it was predominated by influenza A. Sorry. So this is from WHO, the Global FluNet submission from 2021 to 2023. And again, you can see predominantly it's influenza A in the dark blue. This is the FluNet submission region by weeks from last year to this year, and slowly we are still going into the flu season, so the numbers are expected to increase. So flu viruses, there are two main types of human flu viruses, type A and B. Flu A and B viruses that routinely spread in the people are responsible for the seasonal flu epidemics each year. So as I said, there are two types of annual epidemic influenza, which is caused by type A and B. And these influenza virus types A and B are further subclassified through the serologic and genetic testings. And influenza A viruses are divided into subtypes based on the two proteins that are on the surfaces of the virus, which are called the hemagglutinin and the neuraminidase proteins, and there are 18 different hemagglutinin subtypes and 11 different neuraminidase subtypes, H1 through H18 and N1 through N11, and that's primarily the influenza A subtyping. So you can see the graph here that these subtypes are further subclassified into different clades and subclades, and influenza B is divided into two lineages, the Victoria lineage and the Yamagata. How come it's not coming? The slides are not moving. They're stuck. Okay. Sorry. So yes, so this is what I was talking about, influenza A's subtypes and influenza B subtypes. So how are the flu viruses change? What is antigenic drift and shift? And we should understand this. The antigenic drift basically consists of these small mutations in the genes of influenza virus that can lead to changes in the surface proteins of the virus that I said, the hemagglutinin and the neuraminidase. And antigenic shift is an abrupt or a major change in the flu A virus, which results into a completely new hemagglutinin and or neuraminidase proteins in the flu viruses that infects humans. And the antigenic shift can result in a completely new flu A subtype. And the shift can happen if a flu virus from an animal population gains the ability to infect humans. So how does the flu spread? We know the person-to-person transmission via droplets is mainly the main mode of spread between people through coughing, sneezing, and a person might get flu also by touching the contaminated surfaces. What is the onset of the symptoms? The time from when a person is exposed and infected with flu to when the symptoms begin is usually about 2 days, but it can range anywhere from 1 to 4 days. So we do need to keep in mind that there can be an asymptomatic spread. So how long the person is contagious? So people with flu are most contagious in the first 3 to 4 days after the illness begins. And the individuals with flu are contagious 1 day prior to the onset of the symptoms, up to 5 to 7 days after becoming sick. And some people, especially people immunocompromised and young children, are able to infect others and shed the virus even longer. So some of the complications of influenza, you can see that we see a lot of times patients with secondary bacterial pneumonias, which is one of the most common complications post-influenza, can lead to respiratory failure, myositis, encephalopathy, myocarditis, Reye's syndrome, bronchitis, pericarditis, acute myocardial infarction, and even death from overwhelming sepsis can progress rapidly. Also, exacerbation of the underlying medical conditions, for example, pulmonary, cardiac, or metabolic diseases can be a complication of the influenza. Who is at high risk? So this is the list from CDC. Adults 65 years and older, pregnant women, young children, people with comorbidities, as I said, immunocompromised people, including HIV, patients with cancer, chemotherapy, and children with neurologic conditions, chronic kidney disease. Some of the racial ethnic minority groups, especially American Indians and Alaskans, are also at higher risk. And people with disabilities. So what are the potential effects of influenza on adults with chronic health conditions? So once a person gets infected with influenza, as I said, their underlying chronic disease gets exacerbated, which leads to increased hospitalization, increased frailty, and increased mortality. And the COVID-19 Converge experts urge all healthcare professionals to prioritize the flu vaccine for adults with chronic health conditions. What are the 3 actions to protect against flu? First of all, first and the foremost is to get vaccinated. Everyone 6 months and older should get the flu vaccine every season, especially the people who are at high risk. We need to follow the preventative measures, especially the infection control measures, as it is a droplet disease which is spread by droplet precautions. So we need to make sure of good hand hygiene and contact and droplet precautions to be followed. And if someone does get sick with influenza, to have a timely diagnosis and to start the treatment as early as possible with the antiviral drugs to treat the influenza. So what was the 2020-2021 flu season like? And we all know that the flu activity was unusually low throughout the 2020-2021 flu season, both in the US and globally. And this low level of flu activity during this past season contributed to fewer illnesses, hospitalizations, and deaths as compared to the previous flu seasons. And the influenza-associated hospitalizations was the lowest recorded since 2005. And that was because of social distancing, other preventive measures that were in place to reduce the spread of COVID, and led to reduce other influenza infections as well. So we do need to know that influenza virus and COVID may co-circulate, and anyone can get co-infected with both at the same time. Influenza vaccinations will decrease the stress on the healthcare system by decreasing the doctor visits, hospitalizations, decrease influenza diagnostic testing, and save healthcare resources. Who should get the flu vaccine? Everyone 6 months and older should get the flu vaccine every season. And the influenza vaccine composition is one influenza A, especially H1N1, one and the other. So two of the influenza A viruses, one is H1N1 and the other is H3N2, and two influenza B viruses are included in each season's flu vaccines. And all vaccines available this season are quadrivalent vaccines. What are the benefits of getting the flu vaccine? This is the CDC logo this year. A flu vaccine can take the flu from wild to mild. And we all know from several studies that flu vaccination reduces the severity of the illness, even in people who get sick with flu after the vaccination. And there are several studies that has shown that it has been associated with the decreased ICU admission and lower risk of death. So mortality is also significantly reduced in people when you compare it from unvaccinated people. So pregnancy and influenza vaccine, unfortunately, less than half of the pregnant people protect themselves and their babies against the flu. And during the last flu season, estimated 49% of pregnant women in the US got the vaccine. And this leaves more than half of the pregnant women and their babies unprotected from flu. Women who are pregnant through 2 flu seasons should get 2 flu vaccines, 1 in each season. And it's recommended to take it at any time during pregnancy in any trimester, and it will reduce the risk of the pregnant woman getting sick and being hospitalized in the hospital, and also will protect the baby in the initial months right after the birth. So persons with egg allergies, people with egg allergy may receive any vaccine, either egg-based or non-egg-based, that is otherwise appropriate for their age or health status. Previously, it was recommended that the people with severe egg allergy, those who had symptoms other than hives with egg exposure, should be vaccinated in an inpatient or outpatient medical setting. Beginning of this year, 2023-24, additional safety measures are no longer recommended for flu vaccination of egg allergic persons beyond those recommended for receipt of any vaccine, regardless of the severity of their egg allergy. All vaccines should be administered in the setting in which you can appropriately supervise and recognize any allergic reaction and are able to handle it. So we should know that there are 2 completely egg-free flu vaccines are available, which is the quadrivalent recombinant vaccine and the quadrivalent cell culture-based vaccine. If someone had a severe allergic reaction to influenza vaccine previously, such as angioedema, respiratory distress, or who required epinephrine or emergency medical intervention, is the only contraindication to receive the flu vaccine. Why annual vaccine? As we said, that the flu virus is changing every year, and it's a flu vaccine is needed every year for 2 reasons. First, a person's immune protection from vaccine declines over time, so annual flu vaccine is needed for optimal protection. And secondly, we know that the flu virus is constantly changing with the antigenic drift, and the composition of the flu vaccine is reviewed and updated annually to match the circulating strains. So what we should know is what the vaccine does and does not is that the vaccine does protect you against influenza from 2 weeks after getting the vaccination to up to a year later. It decreases the risk of influenza disease and complications, including hospitalization and severe illness, including Guillain-Barré syndrome after influenza-like illness. What the vaccine doesn't do is that it doesn't prevent influenza-like illnesses caused by other viruses like human metapneumovirus, RSV, or some of the other common colds. So influenza vaccination and GBS, we know that the most data suggests little to no risk of GBS. Following the vaccination, you are more likely to get GBS after flu illness than after vaccination. So can COVID-19 and flu vaccine be administered at the same time? Yes, and this was rated by Dr. Sara previously as well. If someone is eligible, both vaccines can be administered at the same time. They are inactivated vaccines, and if you have a patient who's due for both vaccines, you should encourage your patients to get it at the same visit. Why should healthcare workers get the flu vaccine? Healthcare workers have been potentially implicated as a source of flu transmission in healthcare settings. Employees continue to work while they are sick, and unvaccinated workers who are not sick can still be spreading the virus before developing the symptoms. And the potential benefits of flu vaccine is it will reduce the risk of outbreaks in healthcare facilities and decrease the staff illness and costs resulting from the loss of productivity. And you will protect your patients and family members. Now, vaccinating healthcare workers and the impact on patient mortality, you can see this is a study that was done in Scotland that along 20 long-term care geriatric hospitals, in which 10 of the hospitals, the healthcare workers were offered the vaccination, and the other 10, the healthcare workers were not offered the vaccination. And you can see the significant low crude patient mortality in the facilities that vaccinated the healthcare workers. Now, this is a study that was done in Saudi Arabia at King Abdulaziz Hospital to see the knowledge, attitude, and beliefs regarding influenza vaccination among healthcare workers. And you can see that the influenza vaccination coverage was very low during the time of the study, 34.4%. And the most common reason for being vaccinated was self-protection from the illness. And the most common reason for not being vaccinated was a belief that the vaccine is not effective in preventing the disease. Another study on the attitude and beliefs of healthcare workers about influenza vaccination, you can see the reasons and barriers for vaccine avoidance was misconceptions about the need for vaccination among healthcare workers, 67%, and efficacy of the vaccine is not good, lack of trust in the vaccine, and a belief that the vaccine may cause flu. So why do some healthcare workers not get vaccinated? Again, no or poor knowledge about the vaccine, low perception of risk to self or others among the healthcare workers. And there are a lot of myths and inaccurate information, which is common. So the key facts on influenza, types of flu viruses, we said that affect the humans are A and B, can affect anybody in any age group. It causes the annual epidemics and peaks during the winter in Northern Hemisphere. It's a serious public health problem, which can cause severe disease and death in high-risk population. And these epidemics result in increased pressure on health service delivery, and vaccination is one of the most effective ways to prevent infection. So the take-home message is seasonal flu is a serious disease that spread easily and can lead to severe complications, and vaccination is safe and effective and the best way to help prevent influenza and its complications. So protect yourself, your patients, colleagues, and families, and don't get it, don't give it. Thank you.